If you have returned from a long haul flight and you've noticed that either one or both your legs are swollen, then here are some of the points that you have to remember, and the last one being the most important. Now, getting swelling when you fly, especially if it's longer than 6 hours, is quite common, and it happens because of the fact that you're sitting in a fixed position for a long period of time, and as a result, due to gravity, you get fluid building up in your lower legs, your ankles, and your feet. And also, when you're traveling, if you're having a bit of wine or champagne, that probably doesn't help as well, but you do you. Now, when should you be worried about swelling in your legs? Here are some of the pointers. If you find that one leg doubles up in size and is more than the other leg, and you don't have any risks such as surgery in that leg, previous surgery on lymph nodes or in the pelvis or in the groin, then you should probably seek health advice. Another important one would be if you notice any redness and pain in that area, especially when you get off the flight, then this again should be something that you should look for. And if you find that you have any shortness of breath after a long haul flight and you don't have other medical conditions that are related to your chest, for example asthma or you're a previous smoker, and you get a sudden shortness of breath, irrespective of the fact that you don't have calf pain, again I would seek health advice, because with the first two that I mentioned, with one leg blowing up and one being red and tender, this is often linked to a clot in the leg, also known as a deep vein thrombosis, and the best way to diagnose this is to get a duplex ultrasound. And then when it comes to shortness of breath, this could be a clot that has dislodged from your legs and gone into your lungs, causing a clot within the vessels in your lung, causing you to have shortness of breath. And again, this needs to be checked. For a lot of people that travel, they can develop asymptomatic DVTs whereby they have no symptoms at all. And for most people, this isn't dangerous because it resolves on its own, but wearing compression stockings can reduce the chances of you developing an asymptomatic DVT, which is why I generally tell my patients to wear stockings, compression stockings, when they travel.